And welcome to At Issue. As always, we thank you for joining us for a half-hour discussion, this time on suicide and, more importantly, the prevention of suicide, how to recognize the signs that there might be a problem. We're going to talk about that issue with four experts from Knox County to Peoria. And let me first introduce to you Cindy Gilmer. Cindy is the Director of Mental Health Services at the Human Service Center in Peoria. Thank you for joining us.
Thank you.
Across from Cindy is Amy Anderson, who is the Director of Crisis Services at Bridgeway, which covers 4 counties, Knox, Henderson, Warren, and in Henry County.
Yes, thank you.
And we also have with us Ann Bowman. Ann is the Associate Executive Director at the Holt Center for Healthy Living, located in Peoria, and serves how many counties?
All of Central Illinois.
All of Central Illinois is the easy way to put it.
Yes.
And Britt Dunaway is here. Britt joins us from the Children's Home Association of Illinois. He is the clinical coordinator of SAS, which we will talk about in just a moment, and the Line to Hope. Thank you, Britt, for being with us.
Thank you.
Let's start, before we talk about solutions and how to identify the problem, what are the causes of mental health issues? And I'm sure the answer is just as broad as can be. Cindy, is there some way we can encapsulate that?
Well, I believe that the onset of mental illness generally happens teen, even before. Obviously, we're seeing people being diagnosed much younger than they had been brought forward, if you will. And when you're assessing someone who, when you do identify that there's some behavioral health issues going on, you'll find out that they had some different kinds of feelings and different kind of relationships than other children prior to the actual identification. Onset can be from physiological to stressors in the home and families, but a multitude of things, and is clearly a medical problem, much like anything else. It needs to be assessed, diagnosed, and then treated as early as possible to have the best outcomes.
But it can be episodic in nature. It can come on later in life because of some circumstance? Absolutely.
People can only tolerate so much stress and triggers in their lives, from losses to traumas. Most recently experiencing, of course, the tornado in our areas. And people can only manage so much. And life is so chaotic now that I think we do have to be mindful about how much we can manage, and being mindful of each other at work, at home, at play, and really befriending people and getting to kind of see, keeping a pulse on what's going on with those around us, because anyone can be vulnerable to some kind of breakthrough of depression, stress, anxiety, those kinds of issues that merit, again, diagnosis and treatment to have good outcome.
So what do we look for when it comes to mental health? I mean, we may have relatives, we may have friends, and they may be perfectly fine people until a tornado hit, or until divorce occurred, or whatever the case may be. Are there signs, or is that also such a broad category?
I think the biggest thing that you can look for is changes in behavior, significant changes in behavior from that person's normal array of behavior. So if they were previously working and they stopped going to work, or if they took care of themselves really well, they had good grooming and hygiene, and suddenly those things change, they start to withdraw or pull away. All of those kinds of changes in behavior can be a significant indication that something is going on.
And in children, you can see, dropping of grades, more isolation, spending more time in their room, those type of behaviors. Even more aggressive behaviors can be masked as depression that can end to suicide.
And I assume with the onset of social media that you can find indications there?
Right. I mean, I have seen where kids have put things on Facebook about, wanting their world to end and things like that. So parents really need to be vigilant of what kids are putting on their Facebook pages.
I want to point out that we had invited PATH from McLean County to join us, but because of workload over there, they were not able to participate in this conversation. But PATH does serve this service over in McLean County. And also, we want to mention that at the end of the program, we're going to put up some crisis hotline phone numbers for you, so have something ready to write on so that you can write down those numbers in case that is needed in your household. Let me start over on your right, my left, and I want to talk about something called SAS. Can you explain SAS to us? And both of you work in the SAS program. What is SAS? And let me start with Britt.
Okay. SAS stands for Screening Assessment Support Services. What that is, it's a government-funded program, and every county in the state of Illinois has a SAS agency. And so what we do is we go out 24 hours a day, 7 days a week, and we do assessments. And they can be at homes, schools, hospitals, anywhere out in the community. And we're assessing for suicidal ideation, homicidal behaviors, aggressive behaviors, and psychotic behaviors at the same time. And then from there, we are trying to decide if we can send the child or young adult up to the age of 21 back home, or they're at a level that they need to be hospitalized. And then we're going to look for a psychiatric hospital for them to be placed for their own safety. After that, we provide 90 days. It's a 90-day time period where we provide counseling that's out in the home or in their school. It's out in the community. And we'll do individual and family therapy based on what the client and what the family needs during that time.
Amy, this is one-on-one counseling?
This is usually one-on-one, though I would say the whole family system, we encourage involvement of the whole family system. And with children and youth don't function in isolation. They have multiple different people that are involved in their lives, from schools to doctors to sometimes other service providers. And we try to bring all of those people together to try and help stabilize the crisis situation so that the youth hopefully won't have another crisis again. And really that is the primary goal of the SAS program, is to stabilize the immediate risk, and the longer term goal is to kind of link them to support so that if they are having an emerging mental health problem, it's getting treated so they don't continue down a more high risk path for themselves or their families.
And the funding for this, Britt?
Medicaid is our clientele, people that have the Medicaid card, and again, like I said, from 0 to 21 years old, and we'll be providing those services. We understand that SAS is a short-term program, so at the end of those services, we get the families connected with other community resources as well, and possibly even in-home services as well, because we understand that our clientele can't get into an in-office counseling office. So trying to find those services that will support them so we don't have to come back in and do a screening again, or they don't have to go to the hospital. That's our goal.
So there is an interconnection between agencies to make sure that whatever services this particular individual needs, because you may not be able to provide all the services that person needs. So are you working more closely with agencies and making sure that the right service for the right condition is offered?
The goal is to link the child and family to the services that are appropriate. And so our agency has a comprehensive array of services, but we have areas that we don't specialize in. So issues of sexual nature, we would refer to a specialist that is their specialty. So our goal is to link to whatever it is that child's or youth's primary risk area, to make sure that they get the care that they need. And it's an evidence-based program in the state of Illinois that uses funds with both Department of Mental Health, the Department of Children and Family Services, and HFS. So it's a pretty unique program that exists in the state of Illinois. Pretty wonderful opportunity for people to get help.
So far we've been talking about mental health services and suicide prevention services for young people. And I want to talk about the collaboration with the Holt Center in just a moment, et cetera. But I want to also talk about the adult services, and that's where the Human Service Center comes in. For those older than 21, how do you handle them?
We actually, in August, we opened a 24/7 community crisis team that offers support services, again, 24 hours a day in the building. As I mentioned before, we also have we treat everyone in the community as well. So we balance that with the mobile crisis unit team. But we do have a facility now where people can go if they're not sure where to go or want to get out of a home. As you were talking about, maybe there's some issues going on in there and need that respite and need that place to go. So in August, we opened a facility with medical detox, and we have what's called a living room model. And it's for people who are experiencing mental health issues, can also have co-occurring substance abuse problems, maybe not even, as we talked earlier, a major mental illness, but possibly people with a loss, and at this point they don't know where to turn. It may be the first time that they've experienced what they may feel is depression. And the living room actually offers a unique experience in that it's run by people with lived experiences. So you get an opportunity to be with somebody who's been there, done that. You can stay for several days. We do assessments, we do referrals, and we actually begin treatment or services, support services, while they're in the living room and make those connections. Then the peers, which are people with lived experiences, also work in combination with experienced licensed clinicians. So that together really provides a good clinical arena and support for that person.
I've been down to the facility. It actually is a living room. There is a living room. There's bedrooms for people, and they can stay 3, 4, 5, 6 days, depending on how they progress. But I found it interesting. The clients are helped by past clients.
People with lived experiences, been there, done it. Absolutely. They can identify, they can share things that worked for them, share things that have worked for other peers that they've been in treatment with or support groups with. They really know the system from the ground level.
And one of the benefits of this setup is that before, police might say the alternative is take them to jail.
Absolutely.
Now,
absolutely. Yeah, police in some cases have discretionary opportunities in terms of arresting someone. And many times it was like welfare kind of things. They're homeless, they're on the street, not sure what to do with them. Maybe they've even been asked to leave one of the shelters because of some behaviors that have been problematic. That officer can actually deflect from a costly, if you will, and unfortunate start of a judicial or legal system process for an individual and bring him to the living room. And we encourage the officers and worked aggressively with them to introduce this concept to the officers so they have that opportunity or that option.
Because we know that jails are the largest.
Absolutely. Largest inpatient psychiatric unit in the United States. Yes, yes. Cook County Jail, I believe, is up there.
They are the largest.
Yeah. We also, though, of course, want to divert from costly and very restrictive emergency departments as well. As we know, suicide ideations and thoughts can be transitory. And this would give a person that opportunity to begin to learn about it, understand it. What does it mean for them?
One of the things I learned in doing research for the program was that there's a lot of collaboration going on amongst agencies now, and I want to talk about one of those collaborations. You have the Line to Hope, and then Holt Center actually takes from there and helps the individual. Can you explain the line, and then we can have Ann explain what happens after the fact?
The Line to Hope is a crisis line where anybody can call in. It doesn't matter, your age or anything. You can call 24 hours a day, 7 days a week, and talk to a master level therapist about the mental health issues that are going on, depression, anxiety, just those things that are really that you just need to talk to somebody about. We're there to listen to that person. And so what we have done with our partnership with Holt is for those people that would like a follow-up phone call, just to check in on them, see how they're doing. It's completely voluntary. We get their verbal consent to do this. We take that number and that person's name, and we then send it over to Holt. And so, and then somebody there follows up with it just to see how they're doing, and also make sure if we provide a resource, like a name and number, maybe they just need someone to check in, hey, have you called that therapist yet, so that this crisis doesn't happen again.
Let me turn to Ann and explain the follow-up, but before I ask you to do that, we should point out that Mental Health America, which used to be Mental Health Association of Illinois Valley, has merged all of its services into the Holt Center for Healthy Living, and now you're helping in conjunction with the Line to Hope.
Yes. So we do the follow-up calls that Britt sends over our way. We have a staff partner who will call the people once a week and kind of touch base and see how they're doing. We also do the proactive calls, people who are kind of chronic callers. They continuously call and call and call. We've established a listing of those individuals that we make sure that we reach out to on a weekly basis.
So you're reaching out to them instead of waiting for them to call in.
Yeah.
Okay.
And this is funded through the United Way. Just wanted to make sure we say that.
United Way funded program, the Heart of Illinois United Way. How big of a program is this?
Well, with the phone calls,
does it depend on season?
It depends on the season. We probably average around 120 phone calls a month.
Oh, that many.
Now, some of those aren't all new callers. We do have people that have found the line to be very helpful, and so they call, and that when they become the proactive phone calls happen when we find people that call repeatedly.
And there's another set of programs that Holt is involved in that I'd like to talk about. This is directed to high schoolers.
One of them is, yeah.
And how does that work? It's a 2-day program?
Yes. We have developed a 2-day program for high school students. We will go in one day during their health class typically, but it can be in any of the classes that would like us to have us come in and speak. The first day we go in and teach the kids a program called SOS, or Signs of Suicide. It's an evidence-based program. It helps the students learn how to watch for some signs and symptoms. You know, do they have friends that are withdrawing? Do they have friends that were getting really good grades and now their friends aren't getting good grades or aren't wanting to participate and hang out with them? The things we talked about earlier. The students learn how to identify those signs. The second day of the program, we actually have a local actor or actress that will come in and deliver a monologue that is actually a real story someone has experienced that relates to mental illness. One of them is depression. That's the one we do the most often, where we're going to the school, the actor or actress will deliver the monologue based on depression and talk about their experience. And then at the end, we let the students know that it is based on a true story. This is just an actor or actress that has come and donated their time to be able to help you understand a little bit more about mental illness and about depression specifically. The students then take what they learned in the first day, the Signs of Suicide program, and they're ready. They can look at the monologue that was delivered and start to apply what they learned in day one. What were some of the signs that she was exhibiting or he was exhibiting when they were delivering that monologue? What are some things that we noticed that we could have, you know, how could we have helped? Could we have asked questions? Could we have probed more? Could we have paid attention?
Is this preventive in nature?
Yes.
And because it's so difficult to identify when we talk about preventive versus reactive. And mental health can happen at any time, so sometimes it's difficult to say, oh, we need to have a preventive program. So how do you, I mean, can you anticipate these kinds of things?
In some ways, yes. I mean, again, a good example is the tornado in Washington. You know, we're on the spot. The mental health professionals in the area have rallied to be prepared. There's some trainings that are going on in the community to equip even more than the trained clinical professionals, but faith-based operations and other volunteers. So there are certain situations, but on the second hand would be to really get out there and educate the community about mental health and those symptoms and what they are. As I said before, getting a pulse on your neighbors and friends and your community and people you play with and work with, so we can all be helpful to one another and be mindful about, wow, as you mentioned, that's a behavior change. Wonder what's going on with them. And instead of just, you know, ignoring that, oh, that's kind of different, you know, to be able to reach out and say, wow, I noticed that, you know, you haven't completed this report that you typically always had done earlier. Is there something going on that I can help you with? But to be mindful of those little things and don't just assume everything's okay. Reach out to people. And there are some training topics that a couple of us are involved in right now called Mental Health First Aid USA, and you're going to be seeing more of that out in the community and getting that out. Human Service Centers involved, Bridgeway.
Yeah, we got a grant from the Department of Mental Health that for 3 years we're going to try to do 3 trainings every quarter and reach out to as many people as we can. And we're targeting communities, families, people who work in emergency rooms, police officers, officers. We're trying to give general education about mental health so we can help reduce stigma, reduce fear, help people to feel empowered. And I think sometimes people, like you said, they become afraid to ask, you know, what's going on, how can I help you? And they think that they're going to do or say something wrong, and that's simply not true. They're better off to reach out and try and get persons connected to the kinds of resources we're going to give at the end than to let them flounder on their own, because they really probably are struggling.
And think how good you feel when somebody notices that something's going on, instead of ignoring it and just accepting it as status quo and reaching out and saying, hey, I really care about you and I noticed this.
Yes.
It's important. It's powerful. It's powerful.
Go ahead.
That was one of the things we assess when we're working with someone that has suicidal ideation. We're going to ask what their social supports are. Who can they talk to? Because that's one of the biggest things we can help them see, that, you know, life is really worth living for because you have these people in your lives that can help you.
The SOS program and Project Hope, or the Hope Project, I guess it's called, is for high schoolers, but you do the same thing for adults. QPR is what it's called?
Yes. Question, Persuade, Refer. It is more geared towards adults. It's very similar to the Signs of Suicide program. It's just educating people how to, if you notice something different, how to reach out to that individual, acknowledging that there might be an issue, how to approach them, how to let them know that you care, and how to help them find resources and refer them to places that they can seek help.
Can't find the resources until you identify the problem.
That's right.
Exactly.
You have to ask.
We probably should have put this at the front end of the show, but how prevalent is, and the issue of mental or suicide? How common is it?
We actually just saw last week, suicide in teens has gone from the 3rd leading cause of death to the 2nd.
2nd leading cause, right after
Accidents.
Accidents, number 1, and suicide is the number 2
In teens.
in teens.
Yep.
How about adults? Do we have any measurement on adults?
Yeah, there's research out there, absolutely. And again, ranging on the ages and then sex, but we're looking about between like 8th and 10th leading cause of death.
The 8th to 10th leading cause of death.
Yeah.
So what I'm hearing here for both young people and for adults is recognize those changes and do something about it. Don't sit back and say, well, I don't want to meddle.
Don't want to get involved. Yeah. It's not the answer.
So how close are we to truly, the criticism in all healthcare has been we work in silos. How close are we to making sure that this is a collaborative effort so that we see Britt's organization and Ann's organization, Children's Home and HALT, working together? We see the SAS program working across counties. How close are we to bridging that?
It's a priority for us in terms from leadership down to begin to collaborate. One of the good things, yes, I agree with you that we tend to work in silos, but also Peoria, in my opinion, is very good at not duplicating existing services. We have some very, very skilled and qualified variety of services that are for specific needs, and we refer to those as well as they refer to us. So that's positive. But through our efforts now to really expand mental health awareness and suicide prevention and offering this crisis center, we started with our stakeholders from day one, and that is meeting with Unity Points, meeting with OSF, law enforcement were involved in our planning, HALT was involved in the planning, Children's Home was involved. We didn't do it in a silo, and so I think we've learned from the past how not to do that again. And now not only did we meet with them in the beginning to pick their brains on how to render services and support their services, but also we're having ongoing conversations and meetings and sharing the data and what works and what doesn't work. And that's been very helpful.
And on that collaborative point, we've run out of time. We hope you can continue the conversation in your home setting. But I promised you some phone numbers, so let's put those phone numbers up now and we'll list them off so that you can jot down a phone number in case there is a need in your family or amongst some of your friends and neighbors. There is a National Suicide Prevention Lifeline. PATH happens to handle that over in McLean County. The National Suicide Prevention Lifeline is 1-800-273-TALK. Children's Home has the line to HOPE, and that number is 1-855-837-HOPE. Britt, that's for the Tri-County area?
Yeah. And Marshall.
And Marshall. Oh, for the 6 counties that the Heart of Illinois United Way
Correct.
serves. So Marshall, Stark, and Putnam in addition to the Tri-County. Children's Home, line to HOPE, 855-837-HOPE. Bridgeway, serving Knox, Henry, Henderson, and Warren counties.
Yes, and people take the crisis line with them wherever they go. So we get calls all over the United States.
Okay, 1-800-322-7143 is the number for Bridgeway. And finally, Human Service Center, serving Peoria County, 309-671-8084. Let me say thank you to Cindy Gilmer of Human Service Center
you.
and Ann Bowman of the Holt Center for Healthy Living.
Thank you.
And also say thank you to Britt Dunaway of Children's Home Association of Illinois and to Amy Anderson of Bridgeway over in the Galesburg area. We thank you for the conversation, and we look forward to seeing you again next week and in the weeks coming. And remember, February 6th, we'll continue a similar conversation. We're going to be talking about mental health services, the collaborative move for mental health services, coming up on February 6th. We'll see you next week here on At Issue.